Hello, thank you for joining us today. This program is sponsored by the Cutaneous Cancer section of the American Head and Neck Society. We are conducting a patient interview to provide information and increase awareness about cutaneous squamous cell carcinoma, the second most common type of skin cancer. My name is TJ Au, and I'm a head and neck surgeon practicing at Montefiore Medical Center in New York. With me today is one of my longtime patients, Mr. Terry Weinstein. Mr. Weinstein was diagnosed several years ago with a cutaneous squamous cell cancer of the scalp, unfortunately a very advanced form, and he has had several treatments for his cancer over the last 3 years. He is kind enough today to share his story with you. So hi, welcome, Terry.
Thank you, Dr. Al. I appreciate it. Thank you.
Yeah, it's wonderful to see you, and thanks for joining us. We really appreciate you sharing your story. So to get started, I want you to share with us, tell us about how you initially recognized your scalp cancer, and tell us about your first few treatments.
Well, it started about 3 years ago, and I had one area on the back part of my scalp, and then I had a second area in the middle of my scalp, and then I had a third area in the front of my scalp, all within 12 to 18 months. So each time I discovered that and had it diagnosed, I had a Mohs procedure and was supposedly, all cleared up and basically done. But the third time I had the Mohs procedure, I had to do a skin graft, and the person who did the skin graft, the area in the middle, which was the second one, looked very strange to her. So we did a biopsy, and of course, as you know, the second Mohs procedure, the cancer came back. And simultaneously, I had an area on the side of my jaw that looked puffed up, and was initially diagnosed by my personal physician as a swollen gland. But the antibiotics didn't work, and it all came together when they diagnosed the second biopsy as cancer. So that's really what happened. It was over like 12 to 18 months. I had those three different spots on my scalp.
Yeah, wow. Yeah, it's true that after most procedures, usually most of these cancers go away, but unfortunately, you experienced that this returned. And as you mentioned, it did spread to a lymph node in your neck. So can you tell me a little bit more about, what you did at that point? What prompted you to seek care from a head and neck surgeon?
Well, at that point, it was a morning, and the doctor that was doing the Mohs procedure took another look and said, what, we really got to follow up on this. And the lumpy area on the side of my face was very suspicious at that point, since obviously that second Mohs procedure turned back into cancer again. So we left, and they wanted us to do certain procedures, some tests, and so forth. So my wife and I went home, and we discussed it, and we had very strong relationships with people at Montefiore, particularly Dr. Kalbish, who worked with me and my surgeon on another matter related to cancer. So he said, "You come on in." So we came in. He was nice enough to see us immediately. He examined me and said, "We really got to get a handle on this. We want to do an MRI immediately, and we want to see yourself, because you're the squamous cell expert at Montefiore Hospital, and we have a lot of confidence at the hospital doctors." So that's what really happened. So we drove there and we saw him, and we sensed it was very serious, but we had an MRI set up within an hour or two of that visit to Dr. Kalbish, and then I got to see you the next morning.
Yeah, I think you're describing, the process, people commonly go through when they have an advanced form of this cancer. Again, we mentioned most skin cancers can be taken care of by a dermatologist or a Mohs surgeon, but some become more advanced. And you experienced, something that can happen and is somewhat common. People can get multiple cancers of the skin because they're at risk. And then if they get can be more dangerous, they can spread to lymph nodes. So I think that's what, you saw Dr. Kalbish, and he rightly sent you to our oncology team, our multidisciplinary oncology team, to get this taken care of. Let's move on to the surgery you went through. Can you kind of describe what it was like going through surgery, what the process was like and how the recovery went?
Well, I mean, obviously, I came to see you, and it was really, upsetting to find out that I had cancer on my scalp and cancer on my lymph node. And as I don't know, you remember, but my first reaction was, I'm losing all my hair. And and in hindsight, I was silly. I mean, my life is more important than my hair. So, you were very sobering and truthful. And I realized that we have to really resolve this issue as best it can. And you recommended a procedure that was more encompassing in terms of really basically checking my whole scalp and removing not only the area, the lymph node that had cancer, but the other lymph nodes, which were right next to it. I think you said there were 40, and also the salivary gland. And it wasn't pleasant news, but you have to do what you have to do, and to survive in life. And this is what I had to do. So we booked the surgery. So it was a scary time, understandably, but you prepared me, and I had a lot of confidence in you, and we were prepared for the surgery. I guess a week or 10 days after we saw you. The surgery itself, it was a long surgery. It took, I think, 7 hours, if I remember right. And but after I came out, you obviously came to visit and said the surgery went really well. You basically scoured my scalp to make sure that there was no cancer anywhere else, and all the lymph nodes, the 40 on the side of my face, along with the salivary gland, were removed. And this is unfortunately what had to be done to make sure that I have the best chance for long-term survival. And that's really the bottom line.
Yeah, it's true. We were quite worried. You had quite a bit of cancer in the scalp, so we had to remove a pretty big section. And I remember the lymph node you had, showed signs on your imaging that you were invading outside of that it was invading outside of the lymph node. So we did have to do, like you said, we had to remove the parotid gland, all the lymph nodes.
The whole side of my face here, from below the ear to almost basically my chin.
But you've done great. Now you're back to doing a lot of basically your normal life, right? You're working and golfing and out and about.
Yeah, I'm working full time, and I'm still, living my life in a basically normal way. Not saying there weren't ramifications of the surgery, which I know we'll probably discuss in a few minutes, but I'm functioning very well. As you know, we've had scans continuously every 3 or 4 months since the starting surgery, and we had obviously some events that occurred after the initial surgery, as you know.
Yeah, so we can talk about that. Because of the amount of the lymph node spread that you had to undergo radiation after surgery as well. Do you mind sharing that experience and telling us what that was like?
Radiation was really the main treatment for the cancer that was found. So the radiation was set up really in two blocks, one on my scalp, and secondly, a full radiation dose on the side that you did the surgery on. And the radiologist, Dr. Garg, decided that we probably should have some radiation on the other side, because if the cancer escaped from my scalp to my left side of my face, it is possible that it was heading towards the right side. So they did some radiation on both of them. But I had a tough decision to make, because I was told that we can pair chemotherapy with the radiology, and it was really as a secondary treatment, not 100% necessary, but would add another layer of possible protection to me. initially, I didn't want to really have the chemotherapy because, as you know, chemotherapy often gets people, quite sick, especially towards the end of the chemotherapy, and causing, side effects that are pretty well known. But after thinking about it for about 5 or 6, 7 days, I came to an emotional conclusion that number one, I owed it to myself to do the chemotherapy. And secondly, I owed it to my family to do the chemotherapy, to do everything I could to kill off any potential cancer in my affected areas. So I finally did decide to do the chemotherapy as well, from that standpoint.
Yeah, that treatment, it's a hard decision, and it's true. Right around the time we diagnosed you, there was even some data that came out, actually a pretty big trial that showed that adding that chemotherapy, it may not provide advantages that we had once thought. But that being said, your cancer was so advanced, it had, like I said, the lymph node spread was spreading out. The lymph node disease was spreading outside the lymph node. The tumor had recurred many times, so with the surgery, we wanted to remove all of that cancer, but you're right, we can't tell microscopically what might still be there. So, you underwent this treatment and you did fantastic. I mean, there are definitely side effects. You want to share just some of the hard parts of the
Well, I
treatment?
mean, it's not pleasant, but I felt it was necessary. Firstly, you do need to go 5 days a week for radiation treatments. And I think I had 32 treatments. So basically 5 days a week to fulfill 32 treatments. So there was, it was really a large commitment of time necessary to go to the hospital every day during the week to get this radiation treatment. The treatment itself was really not horrible. I would just, they were very nice. I laid on a place to lie down, and I was lined up, and the treatment took maybe 8 or 10 minutes, and then I left. And there was really no ramification from that particularly. But the radiation it builds up in your body, I guess, a little bit over time. And towards the end, I started getting a little sick in the morning, particularly the typical nausea that you hear about. And the chemotherapy, it would be once a week. I took 5 treatments of the chemotherapy, and Dr. Halmos, who was treating me, decided that the effects of my blood were starting to show signs of going to a negative place. And he decided that the 5th treatment, that it was time to end that treatment. So I only had 5 chemo treatments. I guess better than nothing, but they were looking to do at least a handful more. But the treatment itself, going through it, is no big deal. It's just that I had about 3 weeks of time where the nausea and the difficulty in really eating, it was just very distasteful to eat. And I drank really a lot of water, and I tried to eat a little soup or Gatorade, and it was unfortunately very, very difficult. I mean, in hindsight, it had to be done, and I made it through it fine, but it was a difficult time, for sure.
Yeah, I definitely remember those visits, and you're doing a lot better now. But yeah, it took several months, almost
Yeah,
6.
it took, the initial nausea did finally go away. The treatments did affect my obviously I only have one salivary gland left. And I've had a lot of dry mouth, and even to today, I still, even basically almost 3 years later, I think it was 3 years in August coming up, I still have a little bit dry mouth, and you'll see me reaching for the water every few minutes.
Yeah.
I mean, it's gotten a lot better, but it's still part of my life, an accepted part of my life. And I don't really think about it all that much, although I know it's there. And my taste buds took a while to recover back. At the beginning, my taste buds were not doing all that well. But then as time went by, my taste buds did better and better, and I started eating more of my regular foods, all my foods that I would normally eat, and even drinking wine, which I really had trouble with very early on and really didn't enjoy. But it took a while. It may have taken 6 to 9 months to finally get my taste buds back to normal or close to normal. But now I basically eat everything, and I basically drink everything. I have a couple glasses of wine here and there, and I'm doing fine with that at this point. But having cancer is no fun, and there's ramifications to it, and we should certainly state that for sure.
Yeah. Yeah. I mean, thanks for sharing that, going through all that. That was, it was a hard time. I remember
A
all
hard
those
time. It
visits.
was a hard time.
So, making these decisions about your treatments, what kind of materials and information, where did you seek information? What was kind of where did you learn about the cancer and treatments to make these decisions?
Right. Well, I mean, besides speaking to you and my doctors in general, where I got a lot of information from, but additionally, myself and my wife, we went online a lot and we did a lot of reading regarding that. And my brother happens to be a retired doctor, and he's not a head and neck surgeon, of course, but he's very knowledgeable, and he talked to me a lot about it as well. So all that conversation, all that information really gave me a basis to understand what's going on and how to proceed. And that really helped a lot for sure. But a lot of the focus was on information that you provided me and that Dr. Halmos provided me as well. And Dr. Garg a little bit as well, to get information on what's going to happen next. How do things progress? When is the nausea going to go away? When is my salivary gland? What's going to happen with my mouth, with my dry mouth? So I got a lot of information from you and the other doctors for sure.
Yeah, I think you're emphasizing how important it is to trust your team and their experience, and have a dedicated team that is working on this frequently.
Totally. It's paramount. When you go into surgery, when you're there at the hospital that morning, you really need to have confidence in your doctors. And if you have confidence in your doctors, you'll get through it, and to the best of your ability. And it really gave me a lot of comfort when I'm being wheeled into that surgical arena, that I'm going to have the best of care.
Great. So I have just two more questions for you. But the next one is kind of your recent care. So you had, after all these treatments, you didn't have cancer for quite some time, over a year, from what I recall. And
Correct.
And but then you and I know, this kind of progressed. So tell me a little bit about how they found your recurrence of your cancer, where it was, and what treatment you're receiving now.
Right. Well, it was well after a year, and I was starting to get kind of confident that maybe I was heading towards a point where I wasn't going to have any reoccurrences. I know generally it's a 5-year term in terms of being clear of cancer, but if I could have made 2 years, I would have felt really good about it. Unfortunately, I had a spot in my chest wall, or between my chest and my abdomen, that started getting a little puffy and swollen. And it got a little suspicious. So I went back to Dr. Halmos to discuss that with him, and we set up a biopsy. And unfortunately, the area that was in my wall of my chest/abdomen was cancerous. And they also found a couple of areas, nodes, that were showing signs in my lungs of having a little cancer. So I was very despondent in some ways, because I had a reoccurrence, and I was really starting to think that maybe I would have a reoccurrence, but I did.
And we were doing imaging fairly consistently, right? I think
yeah,
we
we do it
found
every
those on
3 or 4 months, but all
CT
of a
and a PET
sudden,
scan.
all of a sudden it appeared.
Yeah.
That's what happens. That's why you have to be very vigilant with this cancer. But we knew what we were dealing with, and fortunately, a new treatment was approved since my surgery. It was called immunotherapy, as you well know, and basically, I would go every 3 weeks to the hospital, and I would visit with my other doctor, Dr. Halmos, who's handling the treatments, and he would examine me, and then I would go for an infusion, as I guess they call it. And the immunotherapy is a newer treatment that stimulates, I guess, your immune system to fight the cancer by stripping the cancer of some of its protections, so your body would be able to fight it. That's what I've read in the online, anyway.
Yeah, that's great. Yeah, you're receiving cemiplimab,
Right.
which is, they're saying it's an immunotherapy. So you just got your most recent dose recently, right?
Yesterday.
Yesterday. Wow. And you've been and also what complicated matters is you got diagnosed with this fairly close to the COVID pandemic, I think shortly before that
Right.
hit us. And so you continued treatments through the pandemic.
Yeah, well, I mean, we wear a mask, and the hospital was very cautious in the way they allow people in and out of the cancer center, which is on Eastchester Road in the Bronx.
Yeah.
And so I basically gone every 3 weeks, and then I'd have 4 treatments. That's 12 weeks. And then I would have a scan. And then I would see the doctor, and then he would review the results with me.
Great. And
I would hold my
thankfully, you've
breath
had an
every
outstanding response.
What's that?
I said, thankfully, you've had an outstanding response, right?
It's amazing. It's like science fiction what this treatment does. And for what I read, and maybe I don't totally understand it, but what I read was in some form or another, I think it strips the cancer. It has a protection. They put up something to signal to your body that it's a normal cell. And it strips it of that, and your body recognizes it as a foreign cell, and it attacks it. If I got it right.
Yeah, that's exactly right.
Yeah.
Yeah, very much so. And not unfortunately, not every patient has that sort of response, but we're finding many patients do, and it's really a game changer for this disease.
Totally.
So I'm so happy that you're
I'm amazed. It's amazing. It's amazing treatment,
because that's been over a year as well, right?
About 14 months now, and Dr. Halmos believes that as long as I don't have any major side effects from the immunotherapy, which I don't, and it's keeping me clean of the cancer, that I should continue it. And he said normally there's not a lot of data on terms of how long and so forth, but he believes that the insurance company is approving it and paying for it at this point. So we'll go as long as we can up to really maybe the end of the second year, and then at that point, I guess we're probably going to stop the treatment, but have to scan me all the time, especially early on, to make sure.
So we're still learning about how long we need to treat patients, and that's really the accepted time at this point. So that sounds fantastic.
I think there was a trial going on for the immunotherapy when you had the surgery. I wasn't really available or able to.
Yeah, that's how quickly this all evolved.
I think 6 to 9 months after, it was almost an accepted treatment already. It was amazing.
Yeah, it has been really, like I said, a real game changer.
Game changer. It really is.
So my last question for you, we talked about how you're really getting back into your normal activities, or have been for quite some time. What have you been doing differently since being diagnosed with this cancer? What kind of precautions are you taking? What would you want to tell people? what they
As you
should
know,
be doing?
my wife and I have a beach house down in Jersey Shore, of course, and we join the beach and pool club every summer, and I play golf outside a lot. So you have to be you got to change everything. I mean, in terms of protecting your head, continuously wearing hats. Uh, I immediately bought sun protected hats. I bought sun protected shirts. I bought shirts that protect me from the sun. And I'm very careful when I play golf. I wear shirts that are protective. I kind of stay in the cart a little more often, so I'm not out in the sun too much. Same thing at the pool club. I mean, I'm always under an umbrella, and it's fine. It's fine.
Yeah.
I mean, I have to protect myself from getting too much sun exposure because a majority of the reason probably for getting the cancer was from the sun.
Are you using sunscreen frequently?
Totally,
Good.
totally.
Yeah.
And I
Um,
remember I had a meeting in my office, essentially, when I came back, and I was wearing a hat, and I just basically disclosed. Everyone knew what I went through, but I just kind of tell people you got to wear a lot of suntan lotion and protect yourself. I mean, when I was younger, a teenager and beyond, sun was no big deal. We would all be out there and sunning and getting a lot of sun and sometimes a sunburn, unfortunately. And I'm sure that was the major factor in getting skin cancer. And it's I mean, there obviously are things to do if they're diagnosed, but much better off not getting skin cancer if you can avoid it.
sure. And how about getting skin exams? Are you seeing the dermatologist once a year?
The dermatologist on Wednesday. See,
Great.
so I saw Dr. McClellan, as you know, and
Great.
she examines me every 3 or 4 months to check because I've always been susceptible to little skin things and I don't know, warts and
Yeah.
other things which
Yeah. I
weren't
mean,
all
we even found another basal cell cancer about, I remember, 6 months after we
right on the
treated you.
side of
So,
my face, just
which
on
is
the right
also
near my
very common.
ear. There was a spot there that it turned out to be slightly deeper than they expected.
Yeah.
So
So
we had a full
yeah. So the
treatment on that.
vigilance is really important.
Yeah, you got to be vigilant, and for better for worse, I need to be vigilant and seeing my doctors quite very often to make sure that if by any chance anything reoccurs, that we would jump on it immediately, to make it as safe as possible for me.
Great. So, last question after, generally, if they're after going through all this, is there anything else you'd like to share with people? Anything you'd like them to know?
Yeah,
Did
I
we
want
cover most
everybody.
of the
Yeah,
bases?
yeah, yeah. I want everybody to know that if uh, if something looks unusual, don't wait. Go to your doctor. Have it diagnosed. Have a biopsy. The earlier you catch these types of cancer, the far better off you are. Mine developed a little bit more, and that was made it a little more difficult, or a lot more difficult. But the sooner you catch it, the better. There are treatments. This immunotherapy is unbelievable. It doesn't work for everybody, but it works for a lot of people. And you should definitely consult with your doctor and a specialist to really check it out. And if you get it, you catch it early, you'll more likely than not be in great shape. And although I went through a lot of tough times, which you really don't forget, you always remember it. But at the end of the day, we survived through it, and you move on with your life. And I want to share that with people that it's a serious matter, but don't be afraid. You gotta fight it, and you gotta go after it, and you will defeat it.
That's wonderful advice. And I know you you believe that. And I've seen you go through all this, and it's been heroic. That's
I appreciate
fantastic
that.
advice. And you mentioned if you see something unusual, I want to tell folks out there that if, the definition of that can be difficult, we have information on our website, the American Head and Neck Society website. We'll have a link at the end of this interview so that you can go look and learn more about skin cancer to see what things you should be concerned about. So that ends our interview. So Mr. Weinstein, on behalf of the American Head and Neck Society and the cutaneous cancer section, we thank you so much for your time today. And thanks for sharing your truly heroic story. We hope those of you viewing have found this helpful. You can find more information on our head and neck skin cancer website, informational website for patients, which we'll post at the end of this video. So thank you, Terry. I really appreciate it. Thanks for sharing that. That's really invaluable information, and I hope everyone found it helpful.
It's my pleasure, Dr. Al.
All right. Thank you.
Thank you. Take care.